In today's episode, we're talking to Andrew Davis. He is a clinical psychotherapist with us at Pacific Integrative Psychiatry, and today we're talking about trauma. And before we jump in, if you'd like to learn more about how to improve your mental health and nutrition for mental health, go ahead and subscribe to this channel. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and I'm the founder of Pacific Integrative Psychiatry. We see adults with anxiety, depression, and sleep issues, and also provide nutrition services for mental health. And we see patients all across California. And Andrew is our therapist in the practice, and he helps people with anxiety and relationships and trauma, which is what we're talking about today. So, Andrew, can you tell us a little bit about what trauma actually is? Because I think when people think about trauma, they're thinking in terms of these big catastrophic events like being in a war or being in a really big accident or something like this. But trauma can show up in other ways. So can you share more?
Yeah, those things you mentioned definitely can lead to trauma. But often what's more common is any situation, event, circumstance, often repeated, that led to someone feeling physically unsafe, emotionally unsafe, or sexually unsafe, or that their safety was threatened. Right? It doesn't have to mean actually life or death, but the feeling of being threatened. Right? Can also look like interpersonal trauma, relational trauma. It's not the actual event that's the trauma, but it's what happens after the event, the way someone learns to cope. So someone can experience, or two people can experience the same event, but only one person might develop trauma symptoms. There are a lot of factors in that, but the way I describe it is just someone's emotional, physical, or sexual safety being threatened, or having interactions relationally, interpersonally, that negatively affected someone's well-being on an ongoing basis, right? It's not just one event, but a pattern of symptoms or ways of coping that have developed that are impacting that person's ability to thrive, as a human.
I like how you shared too that it's not specifically about the event itself, but also how the person responded to the event, and there's lots of different reasons why a person might respond in a certain way. And you also mentioned that emotional safety or a lack of emotional safety can be a form of trauma, and I think that's one that people don't often consider a form of trauma or think it's a form of trauma. Could you expand on that a little bit? Like what was an example of that?
Yeah. It could be a pattern of racially charged microaggressions throughout someone's life, right? It could be growing up in a household where your feelings weren't validated, or there was ongoing presence of maybe negative interactions, even if they're done in jest, even if they're, someone can develop trauma from interactions with others without it meaning that those other people are bad people or abusive people, right? Sometimes that might be the case as far as someone being abusive, but there are a lot of things, especially as a kid, we have needs for emotional attunement, and when those aren't met by parents, whether that's because of availability, physical presence, lack of awareness, or any other factor, that can lead to trauma, right? That can lead to feelings of being minimized or not really learning how to regulate. So there are a lot of factors that lead into what that might look like. But oftentimes with the people I work with, I would say most of them are dealing with issues that fall into the more emotional trauma category. And oftentimes the impact of those things can be even more significant than a single trauma or even a single physical trauma. But it is all just dependent on the person and their experience. Everyone experiences these things differently.
Right. And and as you were saying, like especially with these emotional traumas or the misattunement that happens in childhood, where a child's emotional needs aren't met by their parents. And it doesn't mean the parents were bad or intentionally neglectful. It's just that there was a mismatch between what the child needed emotionally and what the parents were able to give. And this can have far-reaching consequences. So I want to talk a little bit more about that, but also just some of these classifications of big T and little t traumas. I think you've already kind of touched on that, but people might have heard of those terms before. So can you explain what those mean?
Yeah. Sometimes when we talk about trauma, and I think we're starting to move away from this, but kind of historically, we've talked about big T trauma as big single event things like a huge accident or a war or witnessing someone else's death, right? And oftentimes little T traumas are defined as more of maybe some interpersonal trauma, some ongoing smaller things on their own. But the way I see it is trauma is trauma. Someone's little t trauma could be someone else's big T trauma, and vice versa. And the impact of a big T trauma is not always bigger than the impact of a little t trauma. Sometimes it's actually the opposite. So I think it's important for us to just start talking about trauma as trauma, right? So we're not getting in this game of comparing and, oh, my trauma is not as bad as this other person's, or I shouldn't really be feeling this way because someone else has it much worse. And it is all relative to our own experience. And I find it really important to work with the client on what their experience of their trauma is, because that's all we have, right? Their life, their experience, and how it's impacting them. And that doesn't give them any more, it's not better or worse, or doesn't make them more worthy or less worthy of dealing with these challenges.
Yeah, I'm so glad you said that, because it's really not helpful to compare, well, that person had it worse than me, so I shouldn't be feeling like this, because this is your life and this is your experience.
Yeah.
And the more we can give compassion to ourselves around those things and allow ourselves the space to process them, the better we can be in the world too, right? And have a positive impact on the people around us.
Absolutely.
And I agree. I think we're shifting away from this big T, little t model, because sometimes it's just really not helpful, because it can trigger this sort of thinking that, oh, well, my trauma wasn't big enough.
Right.
Right. And so therefore it shouldn't be impacting me. And that can create a whole set of issues with.
Right. It kind of reinforces this stigma, right? And maybe even actually gets in the way of people getting help. And we want people to be able to get help and acknowledge that what they've gone through has had an impact on them. And that there's also a version of this world out there where they can start to move on in a way where they're not as impacted by those things in that way, where they can learn to gain some control back, to gain some stability back, gain some feeling of safety. So they do feel able to kind of work through it, right? Work with it instead of resisting it, instead of denying it, instead of ignoring it or minimizing it.
Absolutely. And so if someone's listening and they're wondering, well, how do I know if I had trauma? Like, how do I know if I just had like a difficult experience or a traumatic experience? Like, how do you make that distinction?
Sure. I'll preface my answer with saying, if you're not sure, it's always good to just see a therapist, right? You can reach out to us here. But some things you might look for are, finding yourself in patterns, experiences, situations that are kind of chronic, meaning like you keep ending up in similar situations or doing certain things that are kind of opposite of what you're trying to get out of things. That might look like if you really are wanting to be in a meaningful and healthy relationship, continuing to find yourself with unavailable people or abusive people, or continuing to having a hard time opening up, right? It could look like having trouble staying present, whether that's like constantly mindlessly scrolling through social media, other patterns of dissociation, maybe having mood instability, physical symptoms that might be unexplainable, and just maybe hypervigilance. There are a lot of different trauma symptoms, but I would say if you're having any of those, or if there's any part of you that's wondering, was that thing that happened maybe more than that thing, or has it led to some things that are impacting me? So it's a good idea to meet with someone and to kind of get an assessment there to see if that could be a helpful way of approaching it.
Great. And so I think you kind of touched on this already, but what are some symptoms or some other signs and symptoms that people should look out for that would be that would be a good sign that they should talk to a therapist?
Yeah, so there's a ton. So I'll maybe kind of hit on a few in different categories. I like to break it down: affect regulation, relational challenges, somatic symptoms, association. So some of those might look like difficulty with emotional regulation, feeling overly emotional, out of control, having trouble describing maybe your feelings, having trouble saying no, issues with boundaries, irritability, trouble not just getting along with people, but maybe getting along with people, trouble making and maintaining relationships, unexplainable physical symptoms, like I mentioned, trouble sleeping, concentration, just not feeling like yourself, not feeling present. There are a lot of symptoms of trauma that, as we continue to get a better idea of trauma, we kind of are expanding this idea, right? We in the past, we used to kind of maybe just think about like flashbacks and, but now we have a better, well-rounded idea and view of what trauma can look like, which can be really validating for someone who has lived a life feeling a certain way and struggling with certain things and not really having any way of describing it or identifying it or understanding it.
Yeah, that's really helpful. And to put into that context of getting stuck in these patterns of behavior or, patterns of thinking that just keep coming up from time and again.
Right.
And kind of like pulling us in the opposite direction of where we want to go. I really like how you said that, because this is something that many of us struggle with, right? We might not connect to that with past experiences or past traumas,
right? But
oftentimes these sorts of patterns are connected to those things. They are rooted in things that we experienced in the past that we might not necessarily be aware of.
Right. Often I've had clients too say, well, like, I think I'm over that thing, or I've done work on that thing, or it's not affecting me. And someone might be cognitively okay with the thing, whatever the thing is, but their body, their system, their nervous system still might be dealing with the impact of that through trauma symptoms. So a lot of those clients that I've worked with, we've kind of continued to kind of be curious about it, have kind of come to an understanding of, this is a thing that's still affecting you, and there are still ways we can kind of work on addressing it. That doesn't always have to look like talking about the trauma. I think that's an important thing for people to hear. Is sometimes it can, but it's really important. As a trauma therapist, I'm very intentional with how we approach those things. It's for me, it's really important that I work with a client to, one, build trust, so they feel kind of safe in this space, but also making sure they have the tools, the resiliency, the coping skills, the social support, all of these things that are really necessary in healing trauma, before we get into the trauma, right? I've had someone I worked with for, over a year, and we didn't really talk about the event, maybe 6 months. But even in that period, there was a lot of healing going on, right? So I think that's important for people to hear, that you don't have to be ready to talk about it, definitely at the first session or the first month or a couple months or ever, right? And it's really important to find a trauma therapist who can be sensitive to that and work with you, meet you where you're at, which is, again, pretty essential in trauma healing, especially when it comes to relational or emotional trauma.
That's really helpful to know, I think, for people, because sometimes folks aren't ready to look at the trauma, right? Or they don't necessarily want to look back in the past. But trauma therapy is not just about looking in the rearview mirror and rehashing everything that's happened to you. It's really about learning how to live in the present and how to move forward with a new set of skills and a new understanding of yourself in a deeper way, so that you can live your life the way that you want to.
Sure. And it's an understanding that's not necessarily on a cognitive level, which is another thing I work with a lot of clients on. It's a lot of helping your body, your nervous system, your being feel safer and in more control. That's a pretty significant part to trauma work.
So if people want to work with you, how can they find out more about that?
Yeah, they can reach out to me here at Pacific Integrative Psychiatry and set up a free consultation call, and we're here ready to see some people.
Great. Well, thanks, Andrew. This was really helpful. And, for anyone listening, I hope this provided some useful information and maybe some insights into any struggles that you might be having with anxiety or depression or stress or burnout. I mean, I don't think any of us are immune to that stuff. And so I think it's helpful just to kind of reflect a little bit and see, okay, what might be going on, and is it time to talk to somebody? So if you'd like to work with our team, we see patients across California by telemedicine. So we'll put our website address on the screen here. You can schedule a free call on our website, and then also the link is in the video description below. So thanks again. And I think next time we're going to talk about emotionally unavailable parents and misattunement and how that impacts us. So stay tuned for that video.